pandemic has affected different groups in our communities in different ways. For the aged, this has been a pretty awful couple of years. Many alone, isolated, inactive, becoming increasingly immobile. And Age UK have issued a report, and it is actually, when you read through it, a pretty depressing report in so many ways. 4.1 million people now saying they're feeling worse in lots of different ways than they were before the pandemic began. And so the impact here is physical, the impact here is mental. One of the stories that I did cover, going back to late summer last year, were the number of dementia diagnoses that had simply been missed. And the argument was put, you can't diagnose dementia over a Zoom call. Well, Ruthe Isden is the head of influencing at Age UK, and thank you for joining us on the programme. I've given this a fairly depressing intro, but it's not a pretty picture, is it?
No, I'm afraid not. The last couple of years have been really hard for a lot of older people. You know, not everybody by any stretch. Some people have, weathered the storm pretty well, as they have across all age groups in the population. But there is a significant group of older people who they've been, as you say, they've been at home, they've been isolated, they've been quite lonely in lots of cases. So we've seen people talking about the fact they're living in more pain than they used to, that their health conditions are worse than they used to be, that they are finding it harder to remember things, that they feel more anxious, that they can't walk as far. I mean, you name it. And within that, there are some really quite serious stories as well. People who perhaps 2 or 3 years ago, they were getting on the bus, going to town, doing their own shopping, and now they're saying, well, do you know what? I can't get up the stairs in my own house. So for some people, it's been pretty catastrophic.
Yeah, and interesting, one of the figures that has been floating around is, despite the length of waiting lists and the problems that people have got, that up to 10 million people haven't actually been for checkups. And many of those are older members of our community not wanting to cause a fuss in times of crisis. So the situation may be worse than we even know.
I think there's going to be quite a lot of unmet need. There's quite a lot of hidden need, I think, that's still out there to come forward. It's partly sometimes people didn't want to make a fuss. They would, they didn't want to kind of bother hospitals when they thought that they were so busy. But also as well, it's really important to remember lots of people were have been very fearful for their own health. They've been very worried about catching COVID. And there was a real lack of confidence, about going into settings, hospitals or GP practices, or into care settings where they thought they might come into contact with the virus as well. So it's really a double whammy. And so people have seen their health conditions in some cases get worse, or they've developed new conditions that they've been really worried about, but haven't felt that it was the right time for them to seek help.
Yeah. I'm sure that's a real issue. Now, you mentioned the care settings, and a couple of quite big points have come out of that. I mean, number one, it was outrageous that some NHS trusts release people from hospital, back into care homes, carrying the COVID virus, which did lead to a lot of premature deaths. A lot of people died in care homes a year or two earlier than they otherwise would have done.
Well, we certainly saw, as you know, a very tragic wave of deaths in care homes, particularly in that first, early period of the pandemic when there was so little understood about the virus and there was so little testing available. I think it's a really difficult conundrum because, of course, it's not a good thing to keep people in hospital when they don't need to be there. It's not the right place for them to be. And of course, at the time, huge numbers of hospitals were very, very fearful about the numbers of people coming in. They didn't want people to acquire COVID in hospital either. And hospital-acquired infections has been a problem throughout. But absolutely, in the absence of testing, we can't be confident about what happened and how some of these infections and how these outbreaks were introduced into care homes.
I think we've got a reasonable idea or a reasonable suspicion. Now, between 30 and 40,000 people that work in care homes have lost their jobs because they didn't want to have the double vaccination. Yet for the National Health Service, despite the threats, it's been decided that's not the case. And the logic is that you can still catch and transmit COVID regardless whether you've had 2 jabs, 3 jabs or whatever it may be. This has put many homes in the care sector into a very difficult position. There were staff shortages before this number left. Is it time for a rethink on this?
Well, I think there's a few things there. I think the first thing to say is, as you say, we've had huge problems in recruitment and retention across the care sector, not just in care homes, but also for the people who come in to look after people in their own homes as well. That was a problem pre-pandemic because, frankly, the terms and conditions are very poor. The rates that are being paid by councils are very low. And that translates through into the work for the workers themselves. That additional pressure then was added through the pandemic when, of course, lots of care workers did a heroic job, but it took a big toll on them personally. And a lot of people decided to step back from that work. And then, of course, subsequently, as you say, we had this question about vaccination. Now, of course, the government has stepped back from that is the proposal on the table that that wouldn't go ahead for staff in the NHS and it wouldn't go ahead for staff working in the community. And so they're now looking at rolling that back for staff in care homes.
And would you welcome that?
Well, we've welcomed it the whole way through because what we've said from the very beginning is absolutely, vaccination is incredibly important. We think it's the right thing to do for anybody working in health and social care because it doesn't fully prevent transmitting the virus, but it does definitely have an important effect. But was coercion ever the right tool to use? We should be persuading people, we should be talking to them about what they're worried about, we should be a lot more carrot and a lot less stick, frankly.
And finally, Ruth, what is it you really want? What do Age UK really want? Is it more money, or is it a rethink about how we provide healthcare and the value we get for it?
I think there's a few things that we really need to look at, and I would say across health and social care as well, because that's a really important part of the picture for older people. And how health and social care work together is an incredibly important part of the picture. So we absolutely need a very significant investment in social care because that's been very substantially neglected compared to other services. So we need to make sure the support's available to people when they are unwell, when they're in the community, when they need to be discharged from hospital. That's a big part of the picture. But then we also need to get those services working well across. So we need to make sure that older people who are living in their own homes, they're not very well, that they have that wraparound support so that they have the support from social care staff when they need it, but they also have the support from nursing, GPs and others. Exactly.
I know it very often isn't.
And it's not just enough to have those services in place. They need to be talking to each other. They need to be working together. So yes, we need the staff. Yes, we need the investment, but we also need to think about how people are working together to do it.
Another area in which a lot needs to be done. Ruthe Isden from Age UK, thank you for coming in.
Thank you.
And joining me here on GB News.